Hi, I'm Dr. Daniel Pryor. I'm a bariatric surgeon here at Saint Alphonsus. I did my general surgery training at East Tennessee State University in Johnson City, Tennessee, and then I did a bariatric surgery fellowship at Johns Hopkins University in Baltimore, Maryland.
Hi, I'm Dr. Chris Riesing, and I trained in Iowa for general surgery and have been practicing bariatric surgery for 23 years.
Hi, I'm Allison Nielsen. I'm a registered dietitian and the bariatric program coordinator. I've been a dietitian since 2018.
We hope to answer a lot of the questions that you might have regarding maybe being a candidate for bariatric surgery. So let's go take a look. So what is obesity? Obesity is a disease where excess body fat is stored in the human body. We typically measure obesity using a measuring system called BMI, Body Mass Index. Body Mass Index is a calculation based on your height versus your weight. And using this, we have different categories for obesity that can range from mild to very severe.
So the causes for obesity, great question. This is a complex problem, and society has a bias that it's all behavioral. And we know from the science that obesity is not only behavioral. There's a huge genetic component to it, and your genes drive your metabolism of your body. There's a complex relationship between your brain and your gut hormones that really impact our eating behaviors, how we feel full, our hunger, and we know that focusing on these things really helps address the cure for obesity, which is why surgery is such an amazing treatment for obesity.
There are so many factors. There can be things like your genetics, your environment, the type of work you do, medications you take, habits that maybe have been a part of your life since you were a kid, among so many other things. So trying to address obesity has to involve a discussion that addresses those other things as well.
You know, so many medical problems are linked to obesity. Definitely hypertension, type 2 diabetes, sleep apnea, cholesterol problems. These are all the risk factors for coronary artery disease and stroke. But we forget sometimes that cancers are associated with obesity, and weight loss from bariatric surgery improves all of these and sometimes cures many or most of these medical problems. It can even reduce the risk of cancers associated with obesity by 40%.
So what are some ways that people try to address obesity and weight loss? Well, probably the most common first step is all the different diets and exercise programs you can think of. And I'm sure that you've seen and heard of most of these. And these have fairly limited success rates. When we look long-term at people who just try diets and exercise, the success rate long-term is only about 5%.
So there's a lot of interest today in anti-obesity medications, the Ozempics and other drugs on the market, and they're very effective, but no drug or treatment is effective if it's not wrapped in a multidisciplinary program. That's what we have here. Our program's accredited by the American College of Surgeons, and to be accredited means we've achieved a quality and safety standard for our patients. And what that really means to patients is that when they come in, they're going to have a team helping them. So most importantly, we have our surgeons and providers that are evaluating the safety of these procedures for patients and helping them start their journey. We also have in-house dietitian and bariatric coordinator, and they're very involved in helping patients understand food choices and how to use different foods to help with their fullness and satiety. We have a psychology team that helps with our patients to make sure that they're in their best state leading up to a surgery. And of course, we have the team, the operative team, that brings patients to surgery and helps them through that operative period. All these team members are working together to help patients achieve their goals, and those team members continue in their journey after surgery. One of the most important things about a bariatric program is that we help patients achieve their goal, not just the surgery, but achieve the goal of weight loss and health. And that takes several visits and longitudinal care over months and years to come later.
So what are some of the surgical options for weight loss? The most popular surgery in America at the moment is called the sleeve gastrectomy. And in this surgery, what we do is minimally invasively, we remove the outer 75 or 80% of the stomach, which leads to smaller portions, better control of hunger, and even causes some metabolic changes that reduce the amount of hunger signals that go to your brain. The second option is the gastric bypass, or Roux-en-Y gastric bypass. And this is a bit more complicated of a surgery, where we create a pouch out of the top part of the stomach and then rearrange the small intestine to connect up to that pouch so that the food travels in a slightly different way than normal. This surgery offers some greater benefits for things like diabetes, acid reflux, and resolution of some other medical problems. And choosing which type of surgery that you choose is really up to you and your surgeon. So who qualifies for bariatric surgery? Well, that's a complicated question. A lot of this is based off of your insurance coverage and your current weight and medical problems. So typically in America, your body mass index, or BMI, needs to be above 40 or above 35 with a weight-related medical problem, such as diabetes or sleep apnea. So what does the whole process look like? Well, first you start with your initial consultation, typically followed by 6 months of visits with us along with additional testing.
Before surgery, you'll meet with our dietitians a minimum of 2 visits. In those visits, we really get down into the nitty-gritty of what does your daily eating schedule look like. We'll give you guidance on directions to go, but we let our patients take the lead in setting goals that are going to be sustainable and achievable for you. Protein is something that you can expect to learn a lot about in our program, and that will carry you through after surgery for the rest of your life.
Then comes surgery, and after surgery, we see you quite closely in that initial healing period. And then we start to see you about once every 3 months, and then after the first year, we continue to see you once a year. So the story does not just end with surgery.
As a patient of ours, we have a plethora of resources for you that can start with our in-person cooking demonstrations that are led by a dietitian. It also can go into our Facebook group as well as our virtual support groups. These are lifetime benefits for our patients. We never want you to feel like you are lacking support after you have this surgery. And we encourage all of our patients to continue to come back for regular follow-ups for the rest of your life after bariatric procedure.
You know, there's many things that differentiate our program. I think most importantly is our focus on outcomes. Quality outcomes and patient satisfaction are premier important to us. And to achieve that, we do several things. Number one, we want to make this a safe place for patients. I start every visit by telling patients this is a no judgment zone. It's hard enough to make the decision, let alone the appointment to come here and the anxiety associated with sitting in a waiting room. We understand this. We understand that this isn't anyone's fault, and we're just here to help you with those things. Another element is we do all of our surgery minimally invasively and robotically. What that means for patients is the shortest operative times, least amount of blood loss, which is minimal in all cases, and really the least amount of pain for a quicker recovery.
So there's so much information out there online with personal relationships that we might have in our lives on what bariatric surgery looks like. And sometimes that can be a little scary or difficult to know what to do. Our expectations for our patients are very realistic. We do not tell our patients that you can never eat carbs again. We don't tell our patients that you will never have a piece of cake or go out to eat. Eventually, we work towards a point where you will feel like you are living life again. That life might look a little bit different. The quantities that you're consuming are much smaller after surgery, but you can still have all foods in moderation after a bariatric procedure with time.
You know, I love coming to work every day because I love to take care of patients that have obesity. It's an opportunity to be a part of a team that helps transform their lives. And we get to see this every single day. We get to help them on their journey as they get prepared for surgery. and then afterwards to reach their goal and most importantly maintain their goal. Patients become lifelong friends for us. We see them every year for the rest of their lives to help them stay on track. Most importantly, because obesity is a chronic disease. This isn't a quick fix, and we need to be partnered in that forever to have success.
We hope you learned a lot about this process, the program, the surgery, and if you have further questions or are interested in getting involved, please visit our website or give our clinic a call, and we can see if you're eligible for a consultation.